Well, it is Heart Month. It is a critical time to raise awareness about COVID-19 and the impact on heart health. So this morning, we are joined by the Dean of UConn School of Medicine, Dr. Bruce Lian. Thanks for being with us. We do appreciate it.
Thank you, Kaylin. Nice to be with you here this morning.
So, Doctor, tell us, what do we know so far about the impact that the virus has on the heart?
Yeah, so the virus affects the lining of the lungs. That's why it produces pneumonia and breathing difficulty. But the virus also attacks the lining of the blood vessels and the heart muscle itself, causing inflammation, which in turn cause the clot to form in the body. And so clot in the vein called deep vein thrombosis, clot in the lungs called pulmonary embolism, and also clot on the arterial side of the circulation causing stroke and heart attack. So it is a serious concern if someone who has COVID-19.
And so for folks who might already have a history of heart conditions, do they need to be even more cautious about, maybe protecting themselves and trying not to get COVID?
Yeah, that's absolutely right. So the social distancing, wearing a mask, maybe even double mask, and washing hands, and about 10% of the transmission of the virus occurs on surface of tables and handles, but 90% of them is transmitted by airborne or aerosol manner. So wearing the mask and keeping distance is very important there.
And you just published a new study that had some really interesting findings. Tell us a little bit about that.
Yeah, so the study was done in collaboration with our colleague at the Jackson Lab, where we studied the antibody that forms after our healthcare workers have been exposed and contracted the virus. So the good news is that everybody developed the antibody. The not so clear news is that the antibody level is low compared to COVID-19 patients who are severe enough to be hospitalized. And so the low antibody in the healthcare worker may not really truly prevent them from future infection or reinfection. And that's why we wanted to vaccinate every healthcare worker, whether or not they had previously contracted the virus.
All right, Dr. Bruce Lian, thank you so much for being with us. We learned a lot, but we still certainly have a lot to learn about this virus.
Yeah, I think so. I think the older age and existing medical conditions such as heart disease, obesity, heart failure, hypertension predisposed to more severe form of COVID-19. Unfortunately, for our older populations, the age they're old, so they're prone to develop the infection. They also tend to have coexisting medical conditions. So it's really double jeopardy. So for the older population, we especially want to make sure that they stay precautious.
Thank you so much for your time, Doctor. We appreciate it.
Thank you, Kaylin. Nice to be with you this morning.